So, if you've been following over the last several years, delivering better mental health and addiction treatment services to San Diegans has been a top priority for our county. We have made record investments over the past 3 years as a county. And specifically, in the last couple months, I have directly focused on issues affecting our children, youth, and transitional age youth, which is individuals 0 to 25. As county supervisor, I have made this one of my top priorities. We've taken on social media companies who are preying on youth with addictive algorithms and contributing to our nation's youth mental health crisis. We're combating the illegal opioid crisis by increasing fentanyl enforcement, prevention, and addiction treatment programs. And we've made resources available to schools in my district and are working to develop countywide policies that help educators limit mobile phone use in the classrooms. But now I want our county to sharpen our focus. On Tuesday, September 24th, I'm asking my colleagues to back my policy to build on the terrific work we've already done on behavioral health over the past few years. Our innovative optimal care pathways model is a data-informed tool we've created to quantify the best utilization of services across many categories of our behavioral health system. Currently, the primary group being helped by the optimal care pathways models is adults. My policy, if passed, ensures this smart approach to delivering behavioral health care is also used to serve children, youth, and transitional age youth. In short, we're going to be able to tell where the greatest needs exist for children and young people. We're going to be able to make sure that the services, infrastructure, investments, and staffing are being maximized. And we're going to be able to focus on helping the most kids, specifically low-income young people and those served by Medi-Cal. The optimal cares pathway will help us use our resources better and ensure services are more accessible. So with me today are some of the experts and providers my office has been working with to help us develop this policy. I want to thank Dr. Ann Bird from Rady Children's Hospital for hosting us today. And I'd like to thank Dr. Cheryl Rode, Marlon Morgan, and Christina Hami-Gillen, who you will hear from shortly, for speaking up and speaking out on this growing issue. These are the people who are in the trenches every single day, and I am proud to support their work with this policy. There is a growing and intense need for behavioral health services for children and young people. As a parent, and in my conversation with other parents, there is strong consensus about the lack of easily accessible mental health and addiction treatment resources for kids. What I've learned is not just anecdotal. There's data to back it up. California ranked 51st out of the 50 states and the District of Columbia for parents reporting difficulty in accessing mental health care for their children. And nationwide, there's been a 60% increase in sadness and hopelessness among young female students since 2011. And there's been a 62% increase in suicides among young people ages 10 to 24. This is unacceptable, and this has to stop. This crisis requires us to do more and do it differently. I want us to invest in more upstream mental health and substance use disorder prevention and treatment for children and youth. The data also shows 50% of adults with behavioral health disorders develop symptoms before adulthood. Around the age of 14 is when crises begin. So we need to get ahead of the curve so we can have healthier adults, and it will create long-term public health savings for taxpayers. If my policy passes, it will initiate a critical dialogue within our community about the behavioral health challenges and the unmet needs. We'll be able to leverage data and quantify optimal service levels, identify service needs and gaps for youth, and establish a long-term comprehensive plan to ensure that the strategic investments of our resources help young people. It will also help us ensure that our county has the workforce, infrastructure, and services and capacity to support the mental and emotional well-being of kids. And finally, we're going to be looking to find methods to optimize payments for all payers that hold Medi-Cal products to support the implementation of this policy. So as we all know, Rady Children's Hospital is the premier healthcare provider for kids in San Diego County. They are in the front lines of this issue, and I'm glad they are our partners in the fight. So with us today is an expert from Rady's to talk about what she is seeing in her day-to-day work. Please welcome Dr. Ann Bird, Medical Program Director for Transforming Mental Health and Primary Care Mental Health Integration Rady's Children's Hospital.
Good morning. So with over 40 locations, including centrally here at Rady Children's, we are honored to provide care to most children and adolescents in our community. In fact, we provided care to more than 270,000 children last year. And with so many young people and families receiving our services, we're in this unique and somewhat disheartening position to see the youth mental health crisis firsthand. Here are some sobering statistics. Rady Children's has seen a 1,700% increase in emergency room visits in mental health crisis in children. In California, from 2016 to 2020, anxiety or depression in children increased by a staggering 70%. And sadly, suicides are the second leading cause of death in adolescents. This is why early intervention is so critical. Research shows that by intervening early, we can halt the trajectory of these disabling illnesses, and we can have a positive impact on education, on social relationships, and on the potential of our future generation. So the key here is early identification, and a great place to do that is in the pediatrician's office. There are, however, some significant challenges that we do need to find solutions for. There's a historic infrastructure and insurance-based divide between physical health and mental health. And families can get lost oftentimes in that divide. There's also a limit to the number of services that are accessible to families. And there is also a limit of shortages of mental health qualified professionals. And so children in our community are sometimes waiting up to 6 months to make an appointment. And while they wait, those kids can often feel and get a lot worse, and families rely on hospitals like Rady Children's and the emergency department to take their kids. Here at Rady Children's, we've developed a unique pilot program that transforms the way we approach mental health. We're bringing physical and mental health together, providing what we call whole child care. We're doing this by embedding mental health clinicians into the primary care pediatric practices and working alongside the pediatricians. Under this model, pediatricians will screen youth for potential mental health issues, and if they identify kids with depression or anxiety or even just the beginning stages of a mental health concern, then that child will be able to see one of our mental health providers in that same office, often on the very same day. Early results indicate from our program a 62% reduction in depression symptoms and a 44% reduction in anxiety symptoms. Now, although our approach is working and it's definitely been life-changing, there are several policy and reimbursement barriers that make this service challenging to scale up. We look forward to working with the supervisor and the county staff to make innovations like this initiative more the standard of care. We support the supervisor's proposal to create a child and youth behavioral health continuum framework and believe it will result in a comprehensive analysis of the youth mental health system in San Diego. Information gathered will help establish priorities for directing future county investments and policy changes that will strengthen the care that we provide to our families. As for Rady Children's, we stand ready to provide our expertise and our experiences to help shape San Diego County's behavioral health system and make our county and our community safer and happier for our children. Thank you.
Thank you so much. So when it comes to behavioral health care, families with kids must have the option to choose providers that are most comfortable for them. Marlon Morgan, after starting his career as a school counselor and licensed professional clinical counselor, launched Wellness Together to support historically underserved students. If my policy passes, families will have greater access to providers of all sizes and types. It's about providing options that work for the kids, and Marlon's organization is one of them. Please welcome Marlon Morgan.
Thank you, Supervisor. It's incredible to be here. I want to talk about It's incredible to be here. I want to talk about the growing need that we've seen over the last 13 years for students and to detect and to treat mental health problems as we see them. The number of students that we see feeling hopeless and persistent on a daily basis has now risen over 40%. Mental health related hospitalization continues to highlight the need for all partners to come together, including the county, community-based organizations, and local education agencies, to play a role in a more organized system. However, there are many barriers to receiving treatment at this point. There's long wait times for outpatient services. There's lack of transportation. There is a complex system to navigate. There's also maintaining. It's also been a challenge to maintain a trained workforce. I can tell you firsthand from as being a licensed provider who previously did provide direct services in schools, it's a hard job. It's day after day of dealing with crisis, and you have to see students who are struggling often, and you don't get to see them as they get better. So it's hard to keep people in a situation where they are continuing to help students and support them, but not be able to see the growth that their efforts are contributing to. There's also a unique strain on local education agencies and schools, but also an opportunity as schools become available to bill for Medi-Cal. But we need to help them with that. We need a plan. That's something totally new to schools. Schools are the perfect place to intervene. As mentioned by some colleagues ahead of this, is we have great access as school-based providers to students to help them early on, especially when it comes to prevention. The studies that we've seen show that school connectedness is one of the most important factors to increasing student mental wellness. Early identification and treatment can prevent some serious problems down the line. There's an urgent need and opportunity to build more capacity and detect and treat signs of mental health distress upstream before they escalate. Schools and school-based providers, again, are uniquely positioned to make the largest systemic impact. And the supervisor's proposal would clearly define and increase the efficiency of how LEAs, the county behavioral health system, and providers work together to maximize resources and do the most good. In response to the 2023 Youth Risk Behavior Survey data, the CDC highlighted a number of areas where schools are uniquely equipped to improve the youth mental health. The areas include increasing students' mental health literacy, teaching social-emotional awareness, and enhancing connectedness on school campuses. And probably most importantly, providing cognitive behavior skills so that they can manage, detect, have insight, and manage their emotions. Providers like Wellness Together can coordinate and often bridge the gap between all of the partners. We can code switch, we can translate between education and the medical model, and we often get the opportunity to triage students and make the system more efficient by getting them to the appropriate level of care even faster. We could not support Supervisor Lawson-Remer's Children and Youth Behavioral Health Continuum Framework proposal any more than we already do, because it brings stakeholders together to work and efficiently meet the overwhelming need we have to increase our youth mental health. Thank you.
So, as I mentioned earlier, parents are very concerned about access to services. With us today is a parent who lives in District 3 and is a community-based clinician who advocates for prevention, early intervention, and innovative strategies to help kids. Please welcome the Director of Service Innovation for the YMCA of San Diego, Christina Halmy-Gilman.
Good morning. I've spent the last 20 years working in youth mental health, and as said, I'm also a parent in the community. Too often, children's behavioral health needs go either misinterpreted as discipline issues or ignored entirely. And this allows those issues to escalate and become more significant problems down the road. In the worst cases, in the very, very worst cases, kids are taking their own lives, and it's happening too often. We need a pediatric system of care that emphasizes both prevention as well as early intervention alongside higher levels of care. Research already shows us what factors contribute to youth mental wellness and their well-being and their positive development. By integrating these practices into spaces where children spend the most of their time, we can promote and reduce the onset of longer-term problems. As I often say, you don't have to be a therapist to be therapeutic. If we equip adults with the tools to help young people thrive and provide equitable access to nature-based activities, to sports, to the arts, and other meaningful experiences, we can give youth a healthy start. And we can save those more intensive services for families with children who truly need it. Clinicians need investments that support balanced caseloads, fair reimbursement rates, and infrastructure that enables high quality care and meaningful employment for the folks that go into this field. This is a community level issue that's demanding a community level response. I'm grateful that this framework is being brought forward for a vote, and I'm really optimistic that the supervisors will do the right thing and meet this moment where we all need to be. Our kids' lives literally are depending on this. Thank you.
Sorry. 1 second. Okay. Another leader and expert in this space is Dr. Cheryl Rode. She has more than 25 years' experience working with youth and families in need of intensive mental health services. For the last decade, Dr. Rode has provided clinical leadership at the San Diego Center for Children. The San Diego Center for Children provides life-changing support for young people and their families at 9 locations across San Diego County. Please welcome Dr. Cheryl Rode.
Good morning. I'm very, very pleased to be here. The current behavioral health system of care is struggling to meet the growing needs of children and youth and families in our community. And our families are facing too many barriers and too many silos to access that care. The provider community understands that the adult system of care has demanded attention and resources due to state policy mandates such as SB 43 and the Care Court. However, the children's behavioral health crisis is well documented, and kids deserve our attention as well. We need to create equity among the entire continuum of care. San Diego County and our provider community are doing incredible work. We are an amazingly collaborative community here in San Diego. But these efforts are stalled by reimbursement policies and administrative burden. The absence of a child and youth behavioral health strategy documented plan in San Diego County makes children and youth system of care vulnerable to redirecting behavioral health and other general funds and or stagnant levels of investment when the need is so pervasive. San Diego Center for Children is part of the Strategic Behavioral Health Initiative, a new multi-sector collaborative effort under the local chapter of the American Academy of Pediatrics. The Strategic Behavioral Health Initiative aims to assess the current behavioral health needs and resources for children and youth in San Diego County and develop a roadmap to an ideal continuum of care. San Diego Center for Children recognizes that to effectively meet the increasing mental health needs of our youth, a more integrated approach to the delivery of services is needed. The approach needs to be rooted in early identification and intervention to prevent the challenges from becoming acute or chronic problems. We need to remove the barriers to access to care so that children receive the right level of care where they need it and when they need it. CalAIM was designed with the promise of significantly boosting funding to our mental health system, and yet we're facing critical hurdles in realizing this potential. It is imperative that we address the contract issues to unlock the full potential of CalAIM for all ages in our community and to achieve the exponential growth in mental health services that our children and families deserve. While the state has made commendable investment in community health workers, mental health coaches, and peer support, there remains a glaring gap in targeted resources for the training and incentivizing of pediatric mental health clinicians. The shortage of professionals, particularly those focused on early intervention and early childhood mental health, is a critical issue that we must address together as a community. We need dedicated funding and incentives to build a robust workforce capable of meeting the growing demands in pediatric mental health. Investing in our clinicians is not just a matter of expanding capacity, it's about ensuring the well-being of our youngest and most vulnerable populations. The Children and Youth Behavioral Health Continuum Framework will result in a comprehensive analysis of children's mental health system of care in San Diego, including identifying gaps in services and assessing the current capacity. Plans will be created from this information to support a responsive and sustainable system of care that connects behavioral health with the right care and alleviating the silos and barriers that our families face. We are very capable of meeting this goal together in San Diego, and I thank the supervisor for her efforts in leading us forward.
Thank you so much. So in closing, I just would like to reiterate the growing and intense need for behavioral health services for children and youth. And the concerns are countywide, ranging from constituents in the East region voicing frustration about the lack of access to services, to the North region where constituents report rising concerns over anxiety, depression, and substance use among youth. With California ranking 51 out of the 50 states in the District of Columbia for parents reporting difficulty in accessing mental health care for children, this is unacceptable. It requires us to do more. It requires us to do it differently and to do it now. We have a strategy, and now I'm asking my colleagues on the Board of Supervisors on Tuesday, September 24th, to back it. Thank you very much. We're here to take your questions or to do one-on-one interviews. Yes. Do we have any statistics? I would prefer to defer to the experts. So if anybody has a statistic on the rate of suicides in San Diego County, we can get back to you. Yeah. So the core of the issue right now is that we've made huge strides strategically in assessing the needs for adults and creating essentially a gaps analysis to understand where all the gaps are and where we need to better allocate resources. And that has been the big driver in a lot of the improvements around our behavioral health investments and services over the last 3 years. We now need to do the same thing for young people. So it's this optimal care pathways strategy that allows us to identify where we need to shift resources, where we need to invest more on the front end, which would ultimately save money on the back end. So if we're able to invest the resources early in prevention and treatment programs, then we end up with less people in crisis. That is very, very expensive. So ultimately, when we're able to implement like a thoughtful optimum cares pathway strategy, it's either cost neutral or actually likely to save us money holistically. The old Board of Supervisors just didn't think this way. And so when I was elected, we said we need to change the way we're thinking about behavioral health. And we've done that in a huge way for adults and have reallocated a lot of our investments towards these earlier prevention, interventions, peer support specialists on the front end. Now we need to do the same thing for young people because the assessment and analysis is different. You have different challenges, you have different gaps, you have different needs. So we're taking the proven approach of the optimal cares pathway that we've already implemented for adults and applying it, and assuming I get the support of my colleagues, applying it to our youth population.
So is it fair to say then that your policy is all about developing, and I don't want a policy, meaning you've got a policy now, we're going to develop a framework around the policy because we've got all the adult stuff, we know what the challenges with the children are, but we're still working on a framework. Is it fair to say you've still got some more work to do?
Absolutely, absolutely. So I think we have done a lot of work and made huge strides with our adult population, and it's now time to apply that to the kids. Yeah.
And you've identified the challenges of applying it to the kids.
Yeah, I mean, I think most folks know I'm an economist by training. I was a researcher and an educator in my former life. And one of the things that I think we've really emphasized over the last couple of years is looking at data and evidence regarding what works and doesn't work on all of these issues facing our county, and certainly in the behavioral health space, where I think the old Board of Supervisors was just sort of always in crisis mode. You know, people would come in the door in an acute psychiatric breakdown, and then the county was sort of mandated to help those people, but they had no plan on the front end to prevent people from getting there in the first place. Now we have a plan on the front end. It's being implemented. We're scaling up these crisis stabilization units. We're scaling up investments in peer support specialists. So we've rolled out these mobile crisis response teams countywide. So we've made massive strides. We understand now how to do that analysis, how to develop that framework, but you can't just, it's not just one size fits all. We can't apply the same framework that we've developed for adults to kids, to young people, because it's a different set of challenges, a different set of gaps. So now we know how to develop a framework, we know that it works, and now we're going to be applying that framework to kids.